Ready?
Yep.
We're ready. All right.
We're good?
We're live?
Okay.
There's a lot. Good to
Great.
go.
Hello, everyone, and thank you for joining. We have on the phone Jordan Feldman, who's the CEO of Right Way Healthcare, Rob Belvedere, the Executive Vice President of IBA, and myself, Michael Lagalate, President of IBA. Again, thank you for joining. I first want to say that throughout this webinar, if you can hold questions, take your notes, write them down. We certainly want to get to questions. And if we can hold that to the very end, we'll have a whole Q&A session. So we appreciate that. And the webinar today is mainly focused on Right Way Healthcare and IBA's partnership. We are offering a concierge service product to all of our members that we're very excited about. And of course, Rob and Jordan will go a little further into the details of that. I want to take a minute to also say that IBA for a while now has been working on putting together an IBA Solutions package, which consists of many different vendors and specialty networks that will bring high quality, low cost care to all of our members. And one of the things we needed to do was to find a hub, so to speak, a concierge service that can direct and help navigate all of our members through such programs. Now, based on the benefit plan design that a particular client might have, Right Way will know exactly how to direct someone into these services. So we have secured over the months, we've secured many relationships and have signed contracts, and we have vendors that, when applicable, again, based on a plan design, we're going to direct them into these special networks. As an example, if someone needs an MRI and they call the Right Way navigator to help them, based on the plan design, the first thing that will be addressed is whether or not there's a pre-cert. Some plans have it, some don't. So they know to address that with the member to make sure that they do get a pre-cert or talk to their provider about obtaining a pre-cert. And then they're quickly going to be able to have several facilities close to their home that is part of this network of freestanding facilities that the member can go to, whereas they're going to save money because a lot of the plan designs are going to have lower co-pays, deductibles designed to steer them that way. So they have an incentive of doing it. And then the client's going to obviously save money because it's going to be at the lowest cost. We certainly don't want to send anybody to hospitals for MRIs. We're going to send them into the special network that we have signed up with to allow members to utilize. That's just one example. We have many, many other networks that are part of the IBA solution. And of course, the most important piece to this was finding the right concierge company to partner with and be the hub of all of this navigating through these programs. So Rob can talk a little bit about how important in the marketplace we believe this is and how it's going to be very well received. What do you think?
Yeah, I think the Right Way Healthcare solution is going to really provide our members and our employers with the best cost, and also the thing we look at probably the most is the best outcomes within the provider panel that exists for whatever client it is. Some of our clients use the Cigna network, some of them use Blue Cross Blue Shield, and other clients are on a reference-based pricing model. So for example, and Jordan will get into more detail, but our goal is to gently steer employees to the highest, best outcome provider in whatever class of care they're looking for. For example, Jordan will show you maybe a knee replacement or an orthopedic solution, and this redirection exists within the network, right? So we know already that the member is in, let's say, the Blue Cross Blue Shield network, and here on Long Island, you might have 600 providers that you could go see within that network. However, what Right Way is able to do, and you'll see this in the demo, is able to narrow that list of 600 providers that you could go see down to the highest rated providers that they recommend. And it's done through their proprietary method of evaluating providers. it looks at outcome, it looks at cost, it looks at disease complication rate, and readmission rate. So all of those factors tie into Rightway's methodology of where they're going to steer employees. The missing piece generally is what the employer wants to do, and that's where they work with the broker and the TPA on maybe some further incentives. It could be through plan design, it could be a financial incentive to use the Rightway solution. We know that when a member does use the Rightway solution, we're getting them to the quote-unquote best provider in whatever category that is, and we're talking about cost and outcome. Those are the two big components of what Rightway is going to do.
Right. And we came up with this solution based on a number of our brokers working with us and inquiring about having not only a phone app, which is going to be part of this presentation. It's a phenomenal phone app that the members are really going to enjoy working on and get a lot of use out of it. But so we are addressing and have worked, for many, many months putting this together, because again, it's something that we see in the marketplace that we needed to, as a TPA, get up to speed with offering this type of a program and this type of servicing level. The really hand-holding, the navigating through the program, it's really, really slick, and we're so happy that we're able to bring it. And again, many, many of our brokers are waiting and excited about this program. And so you think we should switch it off?
One final thing. One of the reasons we gravitated to Rightway as our solution is the folks that work at Rightway, the actual navigators that your members will be speaking to, are either MDs, doctors, nurses, or nurse practitioners. So they're not speaking to a lay person in terms of the medical care they are seeking. So that was important to us because we wanted the information to come from that level of provider. We wanted somebody that was a provider able to speak to the member about other providers. We found that to be, in our minds, the best solution for our clients. And then the final piece is, the concierge piece, which is very important, is, after selecting the said provider in the Rightway portfolio, the navigator will then take it one step further. They'll set the appointment for the member based on their schedule, and they'll help them with any, first-time information that maybe needs to go over to that provider. So, what we'd like to do at this time is, we're excited to show everyone here the solution. It obviously works via your tablet, your phone, your PC. Our members would just go to one of the app stores, Google, Apple, whatever it might be, and download the Rightway Healthcare application. At that point, IBA has already sent Rightway the members' information so they know who is eligible and who's not eligible and what network that member is enrolled in. So Jordan Feldman is going to take everyone through the program, and without further ado, I turn it over to Jordan. Just give us 1 minute. We got to switch him over because he's not obviously. He's up. You got him right there.
See, can you hit that allowed to talk?
So you see the bottom part. Yeah.
Jordan?
Hey, everyone. It's
Hey.
Jordan.
Hey, how are
Can you hear me
you?
all right?
Yes.
We're good.
How is everything going?
Very good.
We're
Thank
doing
you.
well. Thank you for joining us.
Well, Michael and Rob, I really appreciate that introduction, and we are equally excited to partner on the IBA solution. We truly believe that the comprehensive nature of what we're building and the support, the advocacy, the resources that we're providing the individual members can really be transformational in terms of, better healthcare experiences and better healthcare outcomes, leading to better healthcare costs. So, just in terms of what Rightway is, a little bit of the background, what we're doing, how it works. Rightway is a navigation portal designed to help members navigate healthcare. I think as healthcare has become more complex more expensive, there are more choices, more options to consider, we really haven't done the equivalent job of giving our members the resources and the tools and the advocacy to navigate. Even distilling it down to the most simple form, what we're really trying to provide each member of the IBA solution that we're partnering on is that doctor in the family type navigation, that doctor in the family type support. Each one of our navigators is an MD, a nurse practitioner, or a nurse. So trained clinicians who really understand the delivery of healthcare, who really understand the environment with which employees and patients are trying to navigate, and can truly be empathetic to your delivery of care or your care continuum. So having that centralized resource, that guide, that quarterback to really hold your hand from the point of diagnosis to the last bill paid, and guiding you on that journey to the highest quality, most cost-efficient options for your care. And by partnering with IBA and leveraging the best-in-class network and provider solutions that they've integrated, we can do our job in really illuminating those services and really making sure that each member is supported with, you know, the highest level of advocacy to experience their healthcare, and to make sure that not only do they feel supported and empowered, but they're making the most cost-efficient, quality-focused decisions for their care. And, you know, I could show you a little bit of how this works, and I think, you know, that's going to be a big part of this, is how are we engaging members? How are we making sure that they know who we are, what we're doing, how this works, and what's really available to them through the IBA solution. So Reed, if you give my phone access, I could pop to that and share the screen on my phone.
Keep scrolling up. We've given you access as the host. You gotta give him video, I think.
Let me try one thing. Read any luck?
We have you listed in 2 spots, Jordan. So we've got you on the screen in 2 different spots. We gave you the host controls.
Okay, give me 1 sec. I apologize.
You have to give him host on the other one because he's listed twice. Oh, there we go.
All right, we are in action. Sorry for that slight delay. So this is the IBA Solution member portal. And every employee, every member is going to be able to access their unique portal through their iPhone, through their Android device, through their iPad, through the web. It's really meant to meet members where they are and when they need healthcare support and assistance. So the first thing we really want to establish on the Right Way portal is that every member has that dedicated care concierge, that patient navigator that's going to be their doctor in the family, that's going to be their support system, that's going to be there for questions big and small. Everything from, is this covered under my statement of benefits, to where's the best place to get an MRI, to where's the best place to get a joint replacement, to, God forbid, something catastrophic happens. That's going to be your resource. That's going to be your support system. These folks are available via a dedicated phone number. In this case, I have a 212 number, or via chat to, really start a dialogue on anything you need related to healthcare. So, this would start the conversation with your dedicated navigator, who, remember, through the partnership with IBA, knows who you are, what plan you're on, where you're located, any details on your deductible, any details on, any of the components that we need to know to help you navigate. Our navigators are going to be equipped with. So you can really have this dynamic and active dialogue with your navigator, and they're going to be your support system through the entire experience. And once that navigator is dedicated to a member, they stay with them throughout their entire care continuum. We really want to build trust, build continuity, build that relationship such that they're relying on the IBA solution for all of their healthcare navigation needs. And having that quarterback, having that person to really call that's easily accessible, that's knowledgeable about the space and the industry, that's really what creates, what we call those magic moments in terms of getting people to change their historical behaviors that may have been suboptimal, that may have been defaulting to lower quality care, or showing up at the emergency room, or not going for their annual wellness visit, because healthcare is complex, it's frustrating. And too often people throw up their hands, they don't feel like they have support, they don't feel like they have the resources, and they default to those solutions or those options that are expensive and generate poor outcomes. So just by having that navigator, just by having that dedicated resource, we can start to avoid so much of the preventable utilization, the wrong place of care or intensity of care, and all of the waste that's either directly associated or is created by the negative externalities of lower quality care. So that navigator is essential to the whole experience. Now, let's say if you do write your navigator and you say, I need help finding a consultation for a knee replacement, or I need help finding an MRI without contrast, or I need to find an annual wellness visit. Whatever this initiative is, we can now curate a plan. We can curate that package for you to be an empowered, thoughtful, educated consumer. So if you ask your navigator and you said, I need a consultation for a knee replacement, where do I go? What do I do? How much is it going to cost? What's actually going to happen? Your navigator is going to create this plan customized for you. And this is where we can start to insert the elements that Michael and Rob are talking about of quality, of steerage to, what we've deemed to be the best possible options for different care continuums. So, in this case, and this is just one example, you would get a curated list of doctors. You would get a curated list of 5 or 6 of the highest quality, most cost-efficient options for what you need, for everything that you're looking for regarding healthcare. You're going to have information on what's my deductible for this service, what's my copay, what's my coinsurance, how much is this going to cost me. You're going to be able to read details on this doctor. You're going to see, Dr. Fitz is a orthopedic surgeon at Brigham and Women's, and Dr. Fitz is, one of the highest rated knee surgeons in his field, but he's really a knee surgeon. He's not a hip surgeon. And his complication rates, his readmission rates, his outcome scores on knee surgeries are world-class, not necessarily hip procedures or other procedures. And I only highlight that to really drive home the point that we have this insight, we have this data that's really going to help navigate us to the highest quality options. And our quality score is based off of 3 key components. We use national databases that have, advisory board reviews, that have physician and peer-rated reviews, that have consumer reviews, and acknowledge that there's a universe of quality scores out there that's important. We also use complication rates, surgery counts, readmission rates, and outcome scores on surgeon and facilities to get that objective layer on who's the best option, where's the best place to go. And then we do a lot of proprietary surveys and get user feedback on a lot of the experiences with the Right Way doctors. So, that's the navigation piece. That's how we can, really situate a lot of the navigation components of Rightway. Then there's the education component. So much of being an educated, thoughtful consumer is about knowing what you're getting into, knowing that if you're going in for a knee replacement, here's the curated content from the Mayo Clinic about what actually happens in a knee replacement. Why is it done? What are the risks? What are the signs of infection? You can read articles, you could watch videos, whatever it is that you're looking for, we're going to be able to package in a single environment to really help support you as a consumer. And then again, you're always going to be able to chat with your navigator. You're always going to be able to call your navigator. So, you know, I can go through a bunch of examples for these. It could be a knee MRI, right? The discrepancy in pricing for a knee MRI could be everything from $370 if you haven't met your deductible, or even if you have, to, you know, a inpatient network of $1,590. And not that we would give the $1,590 option necessarily, but this is where we're going to work with our partners. This is where we're going to work with our imaging partners, and we're going to work with our IBA network to be able to highlight the most cost-efficient options for your care. So these care plans can really be created about anything. One of the big initiatives in the space is annual wellness visits. It's one thing to tell people to get annual wellness visits. It's another thing to give them a curated list of where they can go for their annual wellness visit. So, you know, if I'm in New York and I need to get an annual wellness visit, I could see, wow, here's 5 options. There's no cost to me. I'm going to be able to select this doctor, tell my navigator why I need the appointment, you know, tell them if I'm a new patient, give them the options, when I'm available, when I can go see this doctor, and that's going to be submitted to your navigator. We're going to make the appointment for you. We're going to handle the logistics. We're going to handle the hassles and headaches and frustrations of being a healthcare consumer. And all of these appointments, and not that that one's been made yet, will be owned in your inbox. So, you know, you'll get an alert a week before, a day before. We'll follow up with you. It's really about closing those gaps in care that are critical to the Rightway solution. Now, Rob and Michael spoke about the concept of us being the hub. So not only can we handle the navigation components, but we can really start to illuminate, you know, for any company, for whatever the custom components of the IBA solution relating to that company may be, we're going to have that all centralized, all coordinated in the application. So, you know, whether it's one of the Blue Cross or Cigna, or, you know, in this case, it's a company who has Aetna, unrelated to this, but you're going to be able to log into your member portal directly from here. You're going to be able to access, you know, anything you need on MD Live or Second Opinions or any of the details behind what's also offered to you. And the reason why this is so important is not only does it help us illuminate kind of the best in class options that IBA has curated for every company, but it really puts it on one platform in one environment. So we don't have to tell our employees, go to 50 different places for your healthcare and hope you know where to go, when to go there, how to get there. It's, you go to the IBA Solution portal, you have all the information there, you have your advocacy, you have the information, you have everything you need to go be a great, thoughtful healthcare consumer. Now, you know, there's a bunch of other stuff I want to show everyone today. I want to be mindful of time, but a few other components. We have, through IBA, all of your deductible information, all of your insurance information, right? We know where you are in your plan. We know your plan benefits. You know, if you have a preventative care copay, if you have a primary care copay, if you're just looking for a specialist, everything's going to be integrated. Everything's going to be coordinated for you. So you'd be able to come in here, you know, you can now see where I am today, but you're going to be able to find that doctor in your network for, you know, everything that you need. Quickly come in here, read any of the details on this doctor, make the appointment, and you're on your way. You know, we're going to have your insurance cards in here. So, you know, this would be stored with your insurance card. You get to the doctor, you're going to be able to email that insurance card to the provider. It's really about centralizing, creating that ease of use around healthcare navigation that is really at the crux of everything that we're doing. I'll pause. You know, I could talk forever and show off a bunch more stuff. I'll pause there. You know, I know we're at 10:30, and that was kind of my cutoff. Rob, Michael, anything that you want me to further into?
Yeah, show one feature. I mean, we all in this healthcare business know that one of the more common questions and concerns from a member would be a bill that they get in the mail or an EOB or something to that.
Yeah.
So that bill advocacy is such a great piece on this and how simple it is to submit.
You get a bill, you get a mountain of bills from a surgery, you don't understand them, you don't know if it was billed properly. This is really one of the most used features on this whole platform, because bills are really where people get crippled, both financially and emotionally. And having your navigator, you know, I was billed incorrectly, it doesn't matter what I say, I'm going to be able to come in here, you know, upload a picture, and let's just say this was my bill, upload a picture of my bills, upload the files, whatever it may be, submit that to your navigator, and all of a sudden, this stack of bills that you don't understand, you don't know if it was billed appropriately, we're going to be able to own for you. We're going to be able to post you. We called the provider, we called the navigator, we did whatever, you know, we needed to do to make sure that that bill resolution was done properly. And that's where we can really gain members' trust. That's where we can really gain, you know, all of the different details behind what's frustrating members, where are their pain points, where can we really be supportive of them. And that really goes back to the whole engagement challenge. We need to be there for members for problems small and big. And that's where we're going to continuously build the IBA Solution brand, in the ease of use, in the positive experiences that every member can have on the portal. And by solving these problems for them, by helping with appointments, by helping with bills, by helping centralize their insurance information, their deductible information, we can be there for them in moments of productivity, and we can be there for them in moments of, I really need support, I really need guidance. And you know, you can't have one without the other. You really need to approach it in a comprehensive manner, and that's what a lot of these features and tools really provide.
Right. Perfect. Well, thank you, and I think everyone knows now why we chose RightWay with all of that wonderful app and features and how easy it is, and we're very much looking forward to working with you. And to everyone listening, this program is going to be just part of what IBA does for all of our members. So any new business, any proposals, RFPs, things that are going to be worked on from IBA from this day forward, we will have the RightWay solution built in.
Yes, it's included for all clients as part of our platform. For us, this is a differentiator from other TPAs and ASO carriers in the marketplace. You know, whether employers want to incent members to use this financially or through plan design is up to them. What we would like to do is just make it available to all of our members. Okay, so it's available to anyone basically enrolled in a new plan coming up, and then on renewal of our groups beginning July 1st here at IBA. So as your group renews, they will have access to this platform. What I really like about it is really the simplification and ease of having all of your information in one place. I feel that one of the things that members struggle with is the disjointed nature of their health plan. Many members are not familiar with their benefits. I feel that this platform gives them access not only to their individual information, their deductible copays, but it also gives them access to what their plan design looks like. And we frequently get questions about, hey, what's my benefit? What's my coverage? This will eliminate a lot of that going back and forth with either the broker's staff or the staff here at IBA, because the member is now empowered with this tool in their pocket that has this information ready for them to view at basically the swipe of a finger. So the other thing I'll speak about is the reason we chose RightWay is simply what you folks see on this screen. We demoed many of the other players in the marketplace, so to speak, and this application and the chat feature and all of the abilities of this application really, really make it first class. It is quick, it is complete. it really, really gives the member everything they need and leaves very little up to question. And that's why we gravitated to Right Way as the solution for our members. It's and as you folks can see, the application is just first class. Jordan is looking at it on his phone right now.
Yeah,
but if you were looking at it on your tablet, it's obviously spec to your tablet or your PC, and it's fantastic. So yeah, we should open up the panel for some questions. We're here to answer them. Really like to see some of the feedback that we have. We've brought this out to several clients who are already going on the platform effective July 1st, and it has been well received. And we'd like to hear your feedback. All right, I'm going to open up the chat. There we go.
Chat open. You can type in a question.
Yep.
Type a question.
Yeah, please type a question in, and we'll try to answer them best we can one by one. All panelists and attendees. Right. We go back to all panelists and attendees. All panelists and attendees. All right.
All panelists and attendees.
Yep.
First question. While we're waiting on the first question, every one of the groups or clients will be set up individually because not every client has the same benefits and the same network. So a lot of what you have been shown and still now seeing through the phone app is the member, obviously, I know it says Aetna there as a sample, but whether you're Blue Cross, whether you're Cigna, it's going to capture the specific network that every one of that the member would be on. And any of the facilities, any of the providers that are going to be recommended, as Jordan showed you, would certainly be an in-network provider for that member.
So we've got a question here. What is the cost and the projected ROI? For our members and employer groups, the cost is included in the IBA admin fee, so there is no additional cost for the program. And the ROI, I'll let Jordan expand on a little bit. Jordan, can you speak about the ROI?
Yeah, so the first part of the Right Way and IBA solution is how can we engage members? How can we support them? How can we give them the tools and resources they need to be great healthcare consumers? The other part is how do we measure this? How do we quantify this? And how do we really stay accountable to IBA and IBA's partners to show you that this is working and show you how it's working and show where the impact is really being derived. So every company on the IBA solution platform is going to get reports, and it's very transparent, and we stay very accountable. And, we want to use this not only for measurement of how we're doing, but also to make sure that we're delivering the return on investment that, we're committed to as a partnership. So you're going to get this report. You're going to see different engagement stats. So page 1 of the dashboard is, engagement. How many people signed up? How many people are using it? How many navigations? How many minutes interacted? Signups over time? Are they chats? Are they calls? Are they push notifications? Are they emails? Then we're going to show you spend. We're going to show you spend in a historical period if we have that, and we're going to show you spend on the IBA solution, and where's that trending, and what have we done to impact that? We're able to show you, how many of the high cost or high risk members are we able to impact? If you think about the distribution of cost, it could sometimes really be situated in those handful of folks, and how active or how hands-on can we be with them? We're also going to show you every interaction, every detail on the interaction, and every component that is built up to prove our ROI. So if we get someone to a specialist visit or we keep someone out of the ER, we quantify that and we show you, what we're able to do, how we're able to support you, and, really get you a accurate snapshot of, where this is working, how it's working, and what impact we're making on the organization. And the last piece is, what's our net promoter score? How happy are people using the Right Way platform? And, what's the feedback from the underlying users been? So, the IBA solution is not only an advocacy and navigation platform for the employees, but it really takes it to the next level and starts to quantify all of the different elements of, healthcare spend and drill into, where the areas of opportunity are and where we're making an impact. And, I think what we found over a period of time is the correlation between engagement and ability to impact costs is really high. So, this is an engagement battle as much as anything. And that's where we're excited. We partnered with IBA, and that's where we're excited to, work with some of the folks on the phone to really make sure we're driving home that impact. Is that helpful, Mike and Rob?
That's great. Thank you very much. Thank you. And lead time. Someone had asked about lead time. Generally, we would like about 60 days lead time. We can do it in less, correct, Jordan? But that's generally what we would look for a new client.
Yeah, so much of this process is about that engagement factor. And, in terms of the technical onboarding, we'll streamline that 2 or 3 days. And I know Mike and Rob and probably my team will kill me for saying that, but, that's how efficient it's become. So the real challenges of onboarding, not even challenges, but the real nuances of onboarding are making sure we get those partnership programs in place, making sure that we're messaging this to every employer group in a unique way. So, we have our solution checklist where, there's about 9 different steps we go through for the Right Way team, for the IBA team, which really acts as one, and then whoever the client is, because every group is created a bit differently, and we want to make sure that we're conforming to them rather than imposing any of our solutions. So that's why we ask for that lag time, to make sure we're on the same page, to make sure we know our engagement strategy, and then, hit go when everyone feels comfortable with that.
Yeah, I saw another question from, I'm going back to Q&A right there. I believe Kathy Johnson had asked a question.
Yeah.
Is the tool based on the situs of the employee, or can it be used anywhere? The tool can be used anywhere. Jordan is in San Francisco right now, and he just looked at the providers that are right around the block from him. It will spec to either where you are at that current time or the zip code of where you might be in the future or are looking for care. So it's really specific to whatever the member wants to achieve in terms of accessing a provider in whatever area. I think there was one more in the chat. Just click back. Showing the average population. I'm not too clear on the question. It says, once on the platform, assuming the average population engagement, do we expect this to affect over calls by how much? I don't know if I'm not too clear on the question. It seems that the average population engagement for one of your clients is around what? How many members, what percentage of the population of an average client do you typically touch in a 12-month cycle, Jordan?
Yeah, it definitely varies. I think some customers we are able to achieve, 50% plus of people on the platform and people active. Other customers are lower, but we typically like to see about 25 to 50% of a population active and activated onto the solution. I think the reality with healthcare is if you look at the distribution of cost for any given organization, you'll probably have 40 to 50% of people who are generating less than $100 of total healthcare spend in a given year. So while we do really want to engage those folks, and we do really need to be top of mind for them, the ability to get them activated and support them is somewhat limited. But that's really where we're targeting, and that's really where our book of business stats have been. And we feel confident that we can get there. With the groups that we onboard.
Great. The question that the gentleman had asked prior was not regarding calls. He wrote back, it was regarding claims. He said, how much could we expect claims to be reduced by, through using the Right Way application? And that's really a tricky answer. We know that by, shifting employees to the best outcome, best cost providers, we're going to save money for the plan. However, it's really to be determined in that report that Jordan gives to the client at the end of the year. Here's a little bit about what the book of business was able to do on the spend.
This is book of business stats. Now, every organization spend isn't created equally. You could have a company that spends $10 million and 10 million of that is non-catastrophic, or 9 million of that is non-catastrophic. And, you can have much more impact through navigation and advocacy on non-catastrophic spend. When you start to talk about organizations that have significant amounts of catastrophic spend, there's not much you could do about a colon cancer or a car accident or, a maternity issue. So when we think about the universe of spend, it's not just, making an impact, but there is the reality of catastrophic claims. So, we've seen across our book of business that the reduction in non-catastrophic spend can be significant. And that's, if you look at the overall healthcare spend in the marketplace, 30 to 40% of it can be wasteful utilization, can be preventable utilization, could be wrong site of service or intensity of service. So that's what we're focused on. I bring up this page. This is one of the organizations that we would work with. And you could see that these 20 claimants, there's only so much we can do around these costs. And these are significant, relative to total spend for an organization. So, it's not like we come in and say definitively we will reduce claims, because, in 1 year you may have none of these, and then the next year you may have 20, or vice versa. So we're really focused on that non-catastrophic spend, and making an impact on that. And we've had great success impacting that across our book of business.
Yeah, it looks that way.
Much agreed.
Okay, so time to wrap up. I think this has been great, Jordan. As always, amazing presentation.
Fantastic.
And we thank everyone that participated in this webinar. We really hope we get to have some activity and work with you as brokers. And what do you want to say, Rob?
I just want to thank Jordan for his time. We're excited to roll this out to all of our members, and we feel like it's going to make a tremendous difference in the lives of our members and the health care that they're currently receiving or will receive in the future. With that, I look forward to working with all of you on our clients. I see some of our clients online, and I look forward to bringing this out to new clients.
Absolutely.
All right. We thank everybody for your time.
Great.
Jordan, thank you.
Thank you, everyone.
Take care, everybody. Thank you so much.
Have a great day, everyone.